The normal body pH is between 7.35 and 7.45. Normal serum levels of bicarbonate or HCO3 are 22 to 26 millimoles per liter. PaCO2 levels range from 35 to 45 millimeters of mercury. PaO2 levels should be between 80 and 100 millimeters of mercury. Oxygen saturations typically range from 95 to 100%. If the pH levels are below 7.35, it indicates acidosis. Conversely, if the pH levels are above 7.45, it indicates alkalosis. Potassium levels should be between 3.5 and 5.0 millimoles per liter. It's important to note that potassium levels are increased in acidosis but decreased in alkalosis. When the client experiences an acid-base imbalance, it's crucial to monitor the potassium level closely. This is because potassium moves in or out of the cells in an attempt to maintain acid-base balance. The resulting hypokalemia or hyperkalemia can predispose the client to associated complications. Respiratory function is indicated by the PaCO2. In a respiratory imbalance, pH and PaCO2 have an opposite relationship. To determine whether the condition is a respiratory problem, look at the pH and the PaCO2. In respiratory acidosis, the pH will be low and PaCO2 will be elevated. For example, a pH of 7.21 and a PaCO2 of 48. In respiratory alkalosis, the pH will be elevated and PaCO2 will be low. For instance, a pH of 7.50 and a PaCO2 of 32. The metabolic function indicator is the bicarbonate ion or HCO3. In metabolic imbalances, the pH and bicarbonates go in the same direction. To determine whether the condition is a metabolic problem, look at the pH and the HCO3. In metabolic acidosis, the pH is decreased and the HCO3 is decreased. For example, a pH of 7.21 and an HCO3 of 29. In metabolic alkalosis, the pH is elevated and the HCO3 is elevated. For instance, a pH of 7.52 and an HCO3 of 47. If the trend of change in PaCO2 and HCO3 is the same, check the percent difference. The one with the greater percent difference between the two is the dominant disorder. For example, if the pH is 7.25, HCO3 is 16 and PaCO2 is 60, the pH is acidotic, and both PaCO2 and HCO3. Explain its acidosis. So look at the percent difference, HCO3. Percent difference is calculated as 24 minus 16 divided by 24, which equals 0.33 or 33%. PaCO2 percent difference is calculated as 60 minus 40 divided by 40, which equals 0.5 or 50%. Therefore, respiratory acidosis is identified as the dominant disorder. Compensation refers to the body processes that occur to counterbalance the acid-base disturbance. It is fully compensated if the pH is normal. It is partially compensated if all three values, pH, PaCO2 and HCO3, are abnormal. It is uncompensated if either PaCO2 or HCO3 are normal and the other is abnormal. Monitor the client's respiratory status closely. During compensated acidosis, the respiratory rate and depth increase in an attempt to exhale acids. During compensated alkalosis, the respiratory rate and depth decrease. CO2 is retained to neutralize and decrease the strength of excess bicarbonate. Respiratory acidosis. Causes of respiratory acidosis include asthma, atelectasis, brain trauma, bronchiectasis, bronchitis, central nervous system depressants, emphysema and chronic obstructive pulmonary disease, also known as COPD, hypoventilation, pneumonia, pulmonary edema, pulmonary emboli, sleep apnea, and certain drugs like opioids, alcohol, and benzodiazepines. Clinical manifestations of acidosis. In respiratory acidosis, the neurological symptoms can include lethargy, confusion, dizziness, headache, and even coma. Cardiovascular symptoms might present as hypotension, dysrhythmias, and warm, flushed skin. Neuromuscular symptoms include muscle weakness and seizures. Respiratory symptoms are often characterized by hypoventilation. NB. If the client has a condition that causes an obstruction of the airway or depresses the respiratory system, monitor the client for respiratory acidosis. Respiratory alkalosis results from conditions that cause overstimulation of the respiratory system. Causes of respiratory alkalosis include fever, hyperventilation, hypoxia, overventilation by mechanical ventilators, pain, and severe anxiety and hysteria. Clinical manifestations of respiratory alkalosis, characterized by excessive hyperventilation and low blood carbon dioxide, can include breathlessness, dizziness, numbness, or tingling in extremities and irritability. Other symptoms can include nausea, muscle spasms, fatigue, and chest discomfort. Acute onset of hypocapnia can also cause neurologic symptoms like dizziness, confusion, and even syncope. Causes of metabolic acidosis include increased acid production, decreased acid excretion, and bicarbonate loss. Specific causes for increased acid production are diabetic ketoacidosis, lactic acidosis, salicylate poisoning, and other toxic ingestions like methanol and ethylene glycol. Decreased acid excretion can be due to kidney disease. Bicarbonate loss can occur through gastrointestinal conditions like severe diarrhea and pancreatic fistulas, or renal loss such as renal tubular acidosis. Other causes include severe dehydration shock and seizures, which can lead to lactic acidosis due to increased oxygen demand. Clinical manifestations of acidosis include metabolic acidosis. Neurological symptoms might involve lethargy, confusion, dizziness, headache, and even coma. Cardiovascular signs can be hypotension, dysrhythmias, and cold, clammy skin. Neuromuscular issues may present as muscle weakness or seizures. Gastrointestinal symptoms could include nausea, vomiting, diarrhea, and abdominal pain. Respiratory signs often involve deep, rapid respirations, which are a compensatory action by the lungs, known as Kussmaul's respirations. It's important to note that you should monitor the client experiencing severe diarrhea for manifestations of metabolic acidosis. The causes of metabolic alkalosis can be varied. Diuretics can lead to the loss of hydrogen ions and chloride, resulting in a compensatory increase in the amount of bicarbonate in the blood. Excessive vomiting or gastrointestinal suctioning can lead to an excessive loss of hydrochloric acid. Hyperaldosteronism results in increased renal tubular reabsorption of sodium with a resultant loss of hydrogen ions. Ingestion of and/or infusion of excess sodium bicarbonate can cause an increase in the amount of base in the blood. Lastly, a massive transfusion of whole blood can lead to metabolic alkalosis because the citrate anticoagulant used for the storage of blood is metabolized to bicarbonate. Procedure for performing the Allen's test before radial artery puncture. The procedure is explained to the client, including that its purpose is to assess collateral circulation. Pressure is applied over the ulnar and radial arteries simultaneously. The client is asked to open and close the hand repeatedly. Pressure is released from the ulnar artery while compressing the radial artery. The color of the extremity distal to the pressure point is assessed. If flow through the ulnar artery is good, flushing will be seen immediately. The Allen test is then positive and the radial artery can be used for puncture. If the Allen test is negative, meaning no flushing is seen, the test is repeated on the other arm. If both arms give a negative result, another artery is selected for puncture. NCLEX style questions, NCLEX test. 1. The nurse reviews the arterial blood gas results of a client and notes the following: pH 7.45, PaCO2 of 30 mm of mercury, and HCO3 of 20 milliequivalents per liter or 20 millimoles per liter. The nurse analyzes these results as indicating which condition: A. Metabolic acidosis compensated. B. Respiratory alkalosis compensated. C. Metabolic alkalosis uncompensated. D. Respiratory acidosis uncompensated. Answer B. Rational. The normal pH is 7.35 to 7.45. In a respiratory condition, an opposite effect will be seen between the pH and the PaCO2. In this situation, the pH is at the high end of the normal value and the PCO2 is low. In an alkalotic condition, the pH is elevated. Therefore, the values identified in the question indicate a respiratory alkalosis that is compensated by the kidneys through the renal excretion of bicarbonate. Because the pH has returned to a normal value, compensation has occurred. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client for manifestations of which disorder that the client is at risk for: A. A decrease in pH and an increase in PaCO2. B. A increase in pH and a decrease in PaCO2. C. A decrease in pH and a decrease in HCO3. D. A increase in pH and an increase in HCO3. Answer B. Metabolic alkalosis is defined as a deficit or loss of hydrogen ions or acids or an excess of base, like bicarbonate, that results from the accumulation of base or from a loss of acid, without a comparable loss of base in the body fluids. This occurs in conditions resulting in hypovolemia, the loss of gastric fluid, excessive bicarbonate intake, the massive transfusion of whole blood, and hyperaldosteronism. Loss of gastric fluid via nasogastric suction or vomiting causes metabolic alkalosis as a result of the loss of hydrochloric acid. A client with a 3-day history of nausea and vomiting and suspected gastroenteritis presents to the emergency department. The client is hypoventilating and has a respiratory rate of 10 breaths per minute. The electrocardiogram monitor displays tachycardia with a heart rate of 120 beats per minute. Arterial blood gases are drawn and the nurse reviews the results, expecting to note which finding: A. The client has acidotic blood. B. The client is probably overreacting. C. The client fluid volume is overloaded. D. The client is probably hyperventilating. Answer D. Clients experiencing nausea and vomiting would most likely present with metabolic alkalosis resulting from loss of gastric acid, thus causing the pH and HCO3 to increase. Symptoms experienced by the client would include a decrease in the respiratory rate and depth and tachycardia. Thank you all for watching this video. We truly appreciate your time and dedication as you prepare for your NCLEX journey. Remember, success comes with the right guidance and preparation, and we're here to support you every step of the way. If you're looking for expert coaching, whether online or live, visit www.brispainternational.com to register for top quality NCLEX coaching. You'll also find valuable IELTS guidance to help you reach your goals. Stay focused, keep pushing forward, and believe in yourself. You've got this.